USCAN is an ultrasound-based tool that employs AI technologies to solve everyday healthcare problems in bladder and kidney care. So why do we perform bladder volume measurements? Diagnosing retention disorders can be very important to a patient's medical treatment, since severe urinary retention can lead to serious medical issues. Not only is a patient more likely to develop urinary tract infections from prolonged urinary retention, but urinary retention can permanently compromise future bladder function. There are multiple reasons for compromised urinary bladder function. Some of the disease processes that can lead to compromised bladder function or a neurogenic bladder include Parkinson's disease, stroke, multiple sclerosis, spinal cord injuries, central nervous system tumors, and more. Finally, one very important reason for bladder volume scanning is the need to reduce bladder catheterizations and the potential complications from repeated catheterization procedures. Catheterization is invasive, can cause trauma, and can lead to infections. In simple terms, catheterizations are uncomfortable for the patient and often unnecessary. A user trained in the ultrasound imaging features of the USCAN can produce diagnostic images of the kidneys, pathological ureters, and actual visualization of the urinary bladder, bladder walls, and other surrounding structures. However, the purpose of this presentation is focused on the use of the USCAN for highly accurate bladder volume assessment. As I'm sure you already know, the urinary bladder collects waste products in urine from the kidneys via two hollow collecting tubes called ureters. These ureters are directly connected to the urinary bladder and form a direct path from the kidneys. It is significant that the urinary bladder is located outside and mostly inferior to the abdominal peritoneal cavity. The normal fluid capacity of the urinary bladder is somewhere between 300 and 500 milliliters, but can be significantly higher. The normal urinary bladder contains around 10 to 17 fluid ounces when completely full in adults. In males, the urinary bladder is anterior to the rectum and is separated by a small space. Also, the prostate gland is located deep and inferior to the urinary bladder. The tube exiting the bladder, called the urethra, passes through this male organ. In the female, the urinary bladder is located low and anterior to the female organs, uterus, fallopian tubes, and ovaries. For this reason, prior to the development of intracavitary ultrasound, the urinary bladder was filled to provide a large acoustic window into the female anatomy. There is more than one way to measure bladder volume. Less than accurate measurements are sometimes obtained by direct measurement with a traditional ultrasound imaging device. This method requires skill on the part of the user to accurately measure the urinary bladder in at least two imaging planes. The method is time-consuming and requires the application of a formula for measuring an ellipsoid. The issue here is that the urinary bladder rarely takes the shape of an ellipsoid. The urinary bladder often is shaped more like a lopsided balloon. To create a 3D representation of the urinary bladder so that one can apply the ellipsoid equation, 2 images and 3 measurements are necessary. This is time-consuming and requires the added expense of an ultrasound machine. Using a traditional ultrasound imager to measure bladder volume is not the most practical method of doing so for several reasons. It's time-consuming. The calculation requires expertise in the use of an ultrasound imaging device. There is an associated cost to the ultrasound machine and its maintenance, and the calculation leaves significant room for error. There are several companies in the market that produce dedicated bladder volume scanners. Most of these companies use a similar method to obtain bladder volumes. The Signostics USCAN is different. In fact, the USCAN is different in many ways, including how the device calculates bladder volumes. If the application of the USCAN is performed properly, the urinary bladder volume measurement will be extremely accurate. The USCAN is able to internalize and see the bladder as a 3-dimensional structure. By employing up to 256 slices through the urinary bladder, as compared to only 8 to 12 from traditional point-and-shoot scanners, the USCAN is in an accuracy class by itself. Positional accuracy is key to USCAN's ability to internalize a 3D image. This is accomplished by cutting-edge motion sensors integrated into the architecture of the USCAN device. The ultrasound imaging features provide for high-clarity definition of bladder walls. Signostics' state-of-the-art computer software, ultrasound processing, and advanced speckle reduction technologies produce clear, concise, and accurate bladder definition. Advanced machine learning is also employed to identify the location and accuracy of bladder boundaries. Thus, the USCAN is a more reliable and accurate way to compute urinary bladder volume. In summary, the Signostics USCAN results in a fast and straightforward way to obtain accurate fluid volumes, a minimal training path to a very accurate volume reading, and a cost-effective USCAN product with a 5-year standard warranty. When used properly, USCAN provides a very accurate, reliable volume result as compared to industry leaders in the market today. USCAN is the only product in the market that recognizes the 3D contours of the bladder using up to a maximum of 256 slices. This allows for the most accurate results against current industry standards and is far more accurate than obtaining results from just 2 ultrasound images or a typical point-and-shoot bladder scanner. The USCAN is a unique device. The product is simple to learn and easy to use. The product itself guides the user through each step, and in the case of very small fluid volumes, the USCAN also is an ultrasound imager that allows you to look directly at the bladder and verify the low volume state. With our standard 5-year warranty, USCAN becomes simply the best choice.